Good evening, parents. Welcome. Thank you for taking time out of your busy days to come together and talk to us about this opportunity we have to make our schools safer. We're joined here tonight by all of our CAS schools. As I think most of you know, we are a network of 5 schools: CAS Tech, CAS STEM, the Advanced Learning Academy, CAS Med, and CAS Lead, our newest campus. And we're also joined tonight with the Health and Law Academies at Fox Tech, where we share a campus. Tonight, we're going to talk to you about a really exciting opportunity to make our schools even safer. So we know that our campuses, our teachers, our leaders are working extra hard every day to make our schools make learning as powerful as possible, but also make our schools as safe as possible. And we're so lucky to live in a community where local leaders, including our county government, decided to invest a significant amount of money, $4 million, into testing our students so to ensure that the coronavirus is not spreading in our schools. So tonight we're joined by a local nonprofit, Community Labs, who's going to explain a little bit more about this opportunity that we have for our schools and how we can work together to make both our children and our families and our teachers as safe as they possibly can be. So I'm going to turn it over to Casey Kessub from Community Labs.
Thank you, Jean. I'm Casey Kassab. I'm the Director of Customer Care at Community Labs, and I'm going to show you about a 10-minute presentation just to give you a quick overview of who we are and what we do, how our methodology works and is different, and kind of what it means to you as parents and what it'll mean for your kids. And then we're going to open it up to any questions that you might have. Community Labs, we're a local nonprofit. We're brand new, about 6 weeks old, and we're creating a safe pathway for schools and businesses to reopen safely, which should allow for in-person learning and for parents to return to work and our community to return to a more thriving state. So I want to tell you a really quick story about one of the safest places in America. This is called the Broad Institute. It's a genomics research lab, and it was created by scientists from Harvard and MIT. So at the beginning of the pandemic, they basically repurposed the whole lab to do what they called assurance testing, which is what we're now doing that I'm going to tell you about. So they decided that they did not want to shut down, and they tested all 4,000 of their employees twice a week. They got results back on the same day, and because they did this kind of proactive approach, they never had to shut down at all during the entire pandemic. So cut to Graham Weston. Some of you all might recognize his name or face. He's a local entrepreneur and philanthropist. He was one of the founders of Rackspace, which is, of course, is a technology company here in town. So Graham was on Governor Abbott's strike force to reopen the economy in Texas. Around the same time, Graham's son came home from studying abroad, and Graham got sick with corona, and he got very sick, and it was very worrisome to him. So through the strike force with Governor Abbott, Graham met some scientists who had partnered with the Broad Institute, and they shared their methodology with him. And so based on the results that they'd had at Broad, Graham decided to utilize that methodology and scale it up to help San Antonio reopen quickly. So here's the problem as we see it. It's called silent spreaders. So just like Graham's son, who returned from overseas and showed no symptoms and wasn't sick at all, but his dad got sick from him, this is the problem, right? Over 50% of the people that have COVID have no symptoms at all. So you can't find them, so you don't know how to stop them from spreading the virus. The way our medical system works is you can't even really get a test if you're asymptomatic. We really only are built to serve people who come in feeling sick or having some symptoms showing that they might have corona. What we learned from the Broad Institute is that we need to be testing asymptomatic people, or these silent spreaders, right? Once an asymptomatic carrier is identified, you can follow the CDC recommendations of quarantining them and then therefore stopping the virus. Right now, because we don't know who is carrying and who is asymptomatic, it's causing a lot of fear, as you guys all know, in our schools and our workplaces. So we feel the answer is assurance testing, which again was started at Broad by these very smart scientists. So the other word for this is accelerated pandemic suppression, but we deploy this methodology that I'm going to go into a little bit more detail here now. So we implement what we call the suppression cycle. Again, we copied it straight from the folks at Broad. who were nice enough to share this methodology with us. So what we do is run these tests once a week proactively. You get your results back in 24 hours. This helps identify those who are carrying it, and then you isolate them for the CDC. You repeat this every week until this crisis has passed. This creates COVID safety zones. Basically, the more we test in certain micropopulations, like a school or business, the more assurance that that micropopulation can have that it's a healthy and safe environment for themselves and their kids. So just to want to affirm, we are not saying that we can cure COVID in any way or that this is going to get us down to zero occurrences, but what we can do is proactively identify people who are carrying it, isolate them, and then stop the spreading. All right, so just to recap, community leaders will provide these micropopulations. We'll run the suppression cycle, which is the testing, the very quick reporting, and the isolation, and then we'll continue to repeat that cycle to keep the spreading down. So our organization feels very strongly that schools are really the key to reopening the whole community and therefore the economy. So we wanted to start and pilot this program in a school. So we partnered with Somerset ISD. You can read some of their statistics here, but we decided to start testing in every school that they have. And we're on about our 4th week of testing. And I've got a quick video here that you all can watch.
Community Labs is here to keep San Antonio open. We think that the first way to do that is to make schools a safe place. If kids feel like they can go back to school, then parents feel like they can get back to work. If parents are back to work, San Antonio's back open again. So we're seeing that first step happen here at the schools that we're working with. We've gone from 40% attendance to 60% attendance, and we think that that is because parents feel safe to let their kids come back to school. It's a very simple process. We have a confirmation of who the student is, so they have an order in their hand. We ask them what their name and their date of birth is. If that checks out, they take the barcode, put that on a test tube, and then they sit down and they swab themselves within 20 seconds and they're back to class. So the actual end-to-end time of a student being out of class is about 10 minutes. I want to put people at ease, let them know this is easier than what they've seen on TV. It's faster than what they've seen on TV, and it's more accurate than what they've seen on TV. The testing accuracy is 95+%. So we feel really, really good that our testing is as accurate as it can be. Our swab is the easiest that you can imagine. It's self-administered. It's a 2-inch swab. This is not the nasopharyngeal swab, which is known as the brain scrubber. Nobody wants to do that test. I don't want to do that test. Nobody in my family wants to do that test. We've got kids as early as 6 years old self-administering this test, and they're completely happy with it.
We have kids at the kindergarten level who are able to self-administer. They're really champions at this. It's minimal time out of the classroom, so to spend 10-15 minutes once a week to test is just a great opportunity for our community and our school district.
I think that testing is the answer to how we keep the country open.
That's essentially it. You might have heard Sal mention there that we've seen the in-person attendance at Somerset increase from 40% to 60% in the few weeks that we've been doing this. As Sal mentioned, the test is very simple and it's painless. It's called PCR testing, and it's really the gold standard in COVID testing. It's over 95% accurate, which is just far and away better than what you'll get. Most med clinics that you go to that do an antigen test are about 50% accurate. So the other wonderful thing about this is that while the test costs us $35 to run through the grant that Jean mentioned, it's being offered free to our schools, at least until the end of the year, and we're hoping beyond that. So we just wanted to talk to you parents about kind of next steps and answer any questions that you might have. This is not mandatory, but of course, we encourage it for your kids. There's really no downside to it. As parents, you will have to sign a consent form the very first time. The consent form will just ask for contact information and for your permission to test. We do ask that you use your contact information, so your phone number and your email address, so that way results can be shared with you parents. I think that's really kind of a base overview. So we can open the floor to Q&A, and let me know what information I can provide to you.
I know you mentioned that it's once a week for the testing.
Mhm.
So for how long will they have to be tested?
We'll test weekly, at least through the end of the year, but possibly beyond that. Answer. So how soon do results come in? Within 24 hours. No, it is not mandatory. We can't insist that you all do it. But the scientists at Broad have found that even if about 20% of the population does this proactive testing and isolation, that would curb the spread enough for everyone to go back to work. So I certainly hope it's more than 20%. As I said, there's really no downside. It's not painful. It's not invasive. Are they? Yes, they will be getting tested once a week. Dion Castillo asks, after quarantine, will the student need a negative test to go back or just do a 14-day quarantine? That's really going to be up to the district. They can either go by CDC guidelines or just decide that, 2 weeks is 2 weeks.
Since we are a network that spans 3 districts, we have slightly different guidelines for each district. So we're encouraging you on those kind of questions to talk directly to your principals. But presuming that the student would come back, then they would probably go back into the testing pool eventually. We wouldn't necessarily require a negative test for them to return.
Calling the test a gold standard and about PCR testing. I can certainly share some material, some data with you all after the call that I can send to the principals to distribute, or you can, Google it. But as I said, it's been shown to be by far the most accurate.
I'm worried about it being painful. My daughter just turned 4 in August and is in the pre-K program. Can I be there to see if it hurts her? Maybe do the test at a drop-off or pickup?
We'd have to figure out those logistics with your school. I would say probably not. What you might want to do instead is practice with your little ones at home. It's a Q-tip just like you would buy at HEB, and it's really just a quick swab around each nostril. We have had pre-kindergarten kids do it. And to be transparent, we've had some children cry at first because they're nervous, but I think watching other kids do it has helped. And then after they do it the first week, it really hasn't been a problem at all. So, but it really is painless and simple. And the administrators will always tell the little kids, oh, it's just like picking a booger. And they think that's really funny. And that usually loosens them up a little bit.
Ms. Rojas asked, how will we be notified when the results are in?
So you'll get an email saying that the results are in, and then you can log into the website and check. If you are positive, you'll get a call from your school that will inform you as the parent that your child is positive.
Ms. Lopez is asking, is all staff doing this?
All right, Jean?
What's the plan? This is an invitation. We think this is a way to make our schools really like the safest that they possibly can be. So our hope is that everyone treats them as that kind of a gift, really, that we can make our schools safer for our teachers and families. And so what we've heard from teachers thus far is that having this testing will really reduce their anxiety about whether there might be a student coming into the school that might unwittingly be spreading the disease. So we think that that's the assurance it's going to offer for everyone. But if there were somebody who had some sort of objection, we would certainly honor that.
If someone is positive, or the whole class needs quarantine?
I don't believe so, but again, I think, Jean, that's going to be more of a district call.
Right. Yeah. So districts all have processes in place for contact tracing. So this testing it's just another layer of hopefully protecting the teachers and the students, but it doesn't materially change any of those processes that are already in place.
I've also heard a bit from the video played and hear that accuracy is 95%. Is it on specificity or sensitivity they're referring, or both? And if so, how relative is a virus being tested?
I'm not sure exactly what you mean by specificity, but, and honestly, the science is all a little bit over my head, but that's what makes the PCR testing better, is the sensitivity to it. So it tests for 3 genes that are present in the sample, and it's extremely sensitive. So again, I'm no scientist by any stretch of the imagination, so we will get you more information on that. Or, I encourage you to do some research on it too. And I apologize. We are a brand new organization, and I'm still learning some of this myself, but we'll get you that information.
If a student tests positive in my child's classroom, Will they test all students?
Well, we can't mandate other students be tested. So I guess no, Jean, I don't know if you guys have any kind of specific plans for if classmates.
And this seems like this is a question that's sort of recurring in the chat. So just to reiterate, everyone, this is not mandatory. We're hoping that once people see that it helps create like a safety zone, as we've described, that most people will want to participate in it. There is a required consent form that you have to sign. And so if you don't sign the consent form, nobody's going to test your child without that. So, so you don't need to proactively decline or do anything like that. The children who have consent forms are those who will be tested. I hope that answers the question.
Ms. Perez, hopefully that answered the question. The next, Dr. Rodriguez posted the link to the protocols for SAISD in the chat. From Ms. Maria, I'm sorry. Another question is, what is the capacity of students that the school has? That's another one that varies per school. June?
Yeah, so right now each of our districts are operating under slightly different guidelines as to what % of students are being allowed to return. And again, we work with 3 different school districts, so we're following the district guidelines. And so that's another question to direct, I think, to your principals. What is the question whether, so each school has a slightly different capacity, and then each district has slightly different guidelines, like SSD is limiting the school district to roughly 25% across the district right now. And our other 2 districts are at higher percentages. So it's going to depend on what district your campus is at.
There are some great comments in here too. Brittany Martinez saying, thank you. So glad that you're excited about this. We are too. And then Laura Davenport saying her 2.5-year-old nephew has had this and that it's painless. It really is. I've done it several times. Leslie Cook, yes, the child can only be tested if the parents consent.
Ms. Lopez asked, has anyone tested positive since school opened up?
Our principals are putting in the chat whether there have been any positive tests. I think what we hope and what we believe is that that we can make sure that there's no transmission happening in schools. We have less control over what happens outside of school, and that's why that's the sort of idea behind safety zones. So our schools, I've visited all of them, are doing an amazing job of following the CDC protocols. And so when kids are wearing masks and they're staying 6 feet apart, that is a very safe environment. And so this is just one extra layer of ensuring that somebody who's contagious isn't coming to school. So I think if you want to know if there have been any reported cases of a person at your campus who might have tested positive, I think that you should direct that question to your principal.
Is asking what data, if any, will be kept other than the positive or negative?
I mean, we'll probably be tracking if school enrollment changes. Certainly if there are any suggestions or if there are any metrics that you want to see, we'll take it into consideration. But this right now, this is more of a proof of concept than anything. And so we do want to make sure that it's serving the purpose it's intended to serve. Gina was asking if a child tests positive, if siblings are going to be quarantined.
I'm not aware of a policy about siblings being quarantined. I think one of the things we do want to make everyone aware of, in addition to this testing, there is free community testing. So like we've had some parents ask, if my child is not in school yet, could they come get tested? Well, not as part of this project, but we can certainly let everybody know where free community testing is occurring. So if you wanted to get a free community test, and you had somebody in your family who tested positive, that might be a really good thing to do.
Mm-hmm. And that information about where and when you can get free public testing is also on the Community Labs website.
Yeah.
Ms. Gonzalez asked, a coach is stating that this testing is mandatory for basketball, yet you stated that it's not mandatory. Which is it?
Oh, I'm glad you brought that up. So there is testing happening I'm assuming that's an SSD question. So the district is rolling out some testing for athletes, and maybe it would be better if we asked would one of the principals want to talk to how that's going to work?
And I put this in the chat window as well. For students who are participating in select varsity athletic programs on the Fox Tech campus, testing is mandatory for participation. There's more information that will be coming from both your child's coach as well as through our trainer and the district regarding that testing. So it is different, to clarify. And you're welcome to reach out to the principal of your child, either myself, Dr. Alcala, or Ms. Benavides, and we can discuss it with you in more detail.
I see one other question too about from Lisa Lopez asking whether both students and adults will be tested. Yes. So the goal here again is to make the building essentially safe. And so in addition to students and teachers, anybody who's student facing, so that might be a cafeteria worker, that might be a bus driver, depending on the campus. All the adults that are interfacing with students will also be, unless for some reason they decide to opt out, which we're hoping people will not do.
I've seen a couple of questions about when this will start, and it's next week across all the campuses. Jean, do you want to give more info on the schedule?
Specifically, our network, as you know, works in partnership with school districts, and we are launching this and hoping it will then be scaled to our partner school districts. So we are launching with CAS STEM, which is in Southwest ISD, and CAS LEAD, which is in East Central ISD on Monday. And then those districts will both be expanding the testing to other campuses the following week. And then with SAISD, or SISD campuses, which is the broad Fox Tech campus, which encompasses the Advanced Learning Academy, Cass Tech High School, and the Health and Law Magnets, those will all launch as one site on Thursday, is it November 5th? As will ALA Euclid and Cast Med. So there are 3 sites that will launch on Thursday, November 5th. And I believe SISD is working on trying to launch at least one other campus as part of this partnership also on Thursday of next week, and then may scale to a few other schools as well.
There's a question if, as a parent, if you opt out now, can you change your answer later? I see no reason why you can't jump in later.
And we would hope that you would, because really everyone, this is just, I mean, my kids actually go to CAS schools, and this is just really about making our schools as safe as possible for our kids and giving all of us, teachers, students, families, a greater level of confidence that when we send our kids to school, that they won't somehow come in contact with the virus. Right. So Dr. Eddie Rodriguez at CASMed wanted us to just reiterate on the consent form, it would really be preferable if you put the parent information. If somebody were to test positive, you will get a phone call, and it will be likely the information that the campus has to call. But if you can be consistent and put the parent information, that'll make sure that the email or the phone call won't go to the student. And we won't test anybody without a consent form. So if you want to participate, you do need to bring your consent forms back.
I just added my personal email address to the chat. If anyone has any questions that they're not comfortable asking publicly, I'm more than happy to take any questions, or if you want to discuss something further. As it's been made, I don't have all the answers, especially the science ones, but I will find them for you. So if you need anything from me, please feel free to reach out.
We're so grateful. I know it's a long day, and this is the evening. So people, if your questions are answered, feel free to go about your evening, but we will stay here as long as we need to, just to answer any questions you might have. And like Casey said, you're always welcome to also talk directly to one of your principals, email one of us. We definitely want people to have a level of confidence in this approach. So we're here to take all your questions until until there are no.
Elizabeth Ortiz, right now it's funded through the end of 2020. We're very hopeful that success in this program that we're seeing so far will encourage more public and private donations. But for now, we have until January to prove to the people who can fund us that this works.
I mean, it was a really wonderful act. Eddie Rodriguez and I got to go to Bexar County when they approved this, and to see our local leaders investing this amount of money in prioritizing our schools was really, gave me a lot of faith and hope in local government. Sounds like if your parents on here and you didn't for any reason get a consent form, sounds like you might need to ask your students about them. I know
Yeah.
this happens a lot in my household. So so they should be in your possession by now, hopefully.
It looked like there were a couple questions. Are kids going to be counted absent if they test positive and are sent home?
Yeah, in Southwest, they are considered remote asynchronous if they are functioning and engaging from home. But if they are sick, they're considered sick and ill and just need a note to come back.
Is that consistent with everyone else, or does anybody want to add any clarifying comments? Okay, so that sounds like that's the policy across all our districts.
As Christina Spill just pointed out, you can turn in a hard copy of the consent form, or you can fill it out digitally, which is obviously a super convenient option.
I'm glad to see some parents saying that this is giving them more faith that they might eventually bring their kids back. I mean, I think our campuses are doing an incredible job of virtual learning, but as a parent of teenagers myself, I do think, there's nothing beats social interaction. Next week, Ms. Ortiz, is when we're planning to start the testing. So Monday for CAS STEM and CAS Lead, Thursday for ALA, CAS Tech, Health and Law, ALA Euclid, and CAS Med, all on Thursday.
So I have a question. My daughter attends CASDEM. I think she said maybe there's about, I don't know, 6 or 7 students per class. I don't know. I think the testing is okay. I don't really know how I feel about it a whole lot right now, but how's that going to look when more kids start coming into the classroom, getting the testing every week? But how's that going to look in a bigger classroom? Right now, I'm okay, because when she tells me those numbers, I'm like, looks like y'all can, be totally, distant from each other.
Right.
And I really like that she tells me that when she's in the cafeteria, if they see them close together, they're like, I'm sorry, you can't be close. And I'm like, well, that's good. They're doing their job. They want to keep you safe. So I like hearing that stuff, that the staff is on top of it. But again, my concern is like, what if when the more kids start coming in, how's that going to look?
Yeah, no, I think that's everyone's concern, Ms. Lopez. So the first thing we're going to do is just start the testing with the folks who are in the building. And thank you for asking that, because I think, parents are very concerned right now. And we are absolutely committed to staying with the CDC guidelines. So all the research that's coming out about this virus is telling us, masks work, staying 6 feet apart works. And so we're definitely not going to squeeze people into a classroom where they can't stay 6 feet apart. Now, at some juncture, if it feels like the community transmission has gone down a lot, some campuses may decide to accept more students. But right now, what we're contemplating is simply testing the students who are currently in school learning and the teachers. So that's what we're starting with. And then, should the pandemic seem to be going down and the districts want to revisit their numbers, then we could certainly entertain that conversation. I hope that research. I'm a parent too. I don't like the idea of my kids being crowded in with other kids. So I know all of our principals are really committed to the physical distancing as well as the masks.
Yeah, that's good to know that you said that, that the masks are working and the social distancing. So I guess as a mom, I don't know, maybe the testing, if I don't think I've heard any cases since at CASTEM. My daughter has told me differently at other campuses,
Right.
but I'm just curious, like, why all of a sudden the testing, if everybody's, doing their part, why do you think that's really important? Like, why now?
Well, so I'll
Well,
tell you.
sorry,
I'll
go
tell you the origin of why we approached community labs, and that's because one of the things that we do is we ask teachers what is the one thing that would make your lives better right now. And the teachers, I think, have a lot of anxiety around worrying that a student maybe could unknowingly bring the virus in, because young people are the ones who are the most likely to be these silent spreaders. And so while it is, I think, very safe, I've visited all our schools, I think there's still concern that if we could do something more to ensure everyone's safety, why wouldn't we do this? So think of this as like another layer of safety. We're not taking away any of our existing safety protocols. We're just adding an additional one to reassure, especially the teachers, but also the parents, that when I send my child to school, the person, even if they're sitting 6 feet away, doesn't have the disease, and maybe they aren't paying attention and they bump into the child or whatever. Like, these things can happen even when people are being careful. So it's just adding that extra layer of protection. And I'm excited about it because I don't know, I'm hoping for a vaccine like anyone else, but I also feel like this is the situation we're dealing with right now. So anything we can do to make our schools safer is just a gift. And I'm super grateful for that.
Yeah. Kind of just to add on to that, everyone knows to stay distance from people who we know have COVID.
Right.
What's different about this testing is it helps you isolate yourself from people who, without this testing, we wouldn't know that they have COVID or that they're carrying COVID. So it's the reason that it's happening now is because it's brand new technology, and we just now have a lab here in San Antonio that's set up to do it. So to Jean's point, we're very excited to be able to offer this to you all, and hope that you all can see the upside. Maybe if after a few weeks, when you all kind of get to see it in action and hear results, maybe it'll kind of ease your mind a little bit more.
Yep. So we have a couple more questions in here. If a student volunteers, can he or she choose how frequently they test? Well, we're only going to be offering the testing. Community Labs has like a really full schedule, so we had to like find our day, and so we'll be only offering the testing once a week at each of our sites. So students can certainly take advantage of it every time it's offered, but there won't be like additional days or anything like that we could take advantage of it.
Right.
So I asked that question, and I'm wondering if they can opt to do it like every other week or once a month, or if they'll be required to do it weekly.
There's no requirement. It's really up to the parents and the family. So if for some reason they only wanted to do it once a month or every other week, that would be up to you.
Thank you.
Mm-hmm.
So the question here from Elizabeth Ortiz. So yes, your child will be out of class for about 10 minutes. We're working with all your schools to try to make that as non-disruptive as possible, whether it's during their homeroom or before school or after school. We have our testing teams out in teams of 2, and that 2-person testing team can test 100 people in an hour. So they have it down to a science, and they move people through really quickly, but we do not want to take your kids out of the classroom any longer than necessary.
There won't be any repercussions, of course not, if a student doesn't test. No, this is optional, and we really see this as something that is exciting and wonderful. And the more people who do it, the more certain everyone can feel that nobody's spreading the virus in the building. But there won't be any negative repercussions if for some reason you're not comfortable with the testing.
What has been the rates at the schools where you've already incorporated the system?
It's been quite low. I don't have the data right in front of me, and Kat, I don't know if you have quick access to it, but there's been very few positives. And the good thing about it is the system worked exactly like it should. This should kind of function as a security alarm, right? If somebody breaks into your house and the alarm goes off and the cops show up, it's exactly how it worked. If there's a positive test, within 24 hours, that child is taken off campus and self-quarantining. So while, like I said earlier, we can't guarantee that there will be 0 cases in your school, we can mitigate the risk to you as much as possible. So
I don't see any other questions, so I just wanted to give our principals a chance if any of you wanted to weigh in on anything else as we're getting up on the hour. And again, we'll stay as long as people have questions they want to ask, but did the principals have anything you wanted to add specific to your campus, or any questions we may have missed?
I just wanted to say that today during lunch, we talked about this with our students, and one of the students actually researched more or less what this test, really consists of. And if you look at your keyboard and you look at the size of one of the letters, the little squares where you're typing, that's about how far in that Q-tip is going to go. It's just right there. It doesn't go all the way in. It's just right in the nostril. So the kids felt a little safer when they saw and they heard from one of our students say, oh, it only goes in this far. That's it. So they're doing it for those kindergarten kids, and it's just a little swirl inside. This is not the one that goes all the way up as was shown in the video. That it's not this brain thing, it's just right there, and it just swirls a couple of seconds, then the other nostril, you put it in the test tube and you're done. So that kind of got rid of a lot of apprehension from my high school kids, and they were like, oh, okay, well, that sounds great, you know, I'll tell my parents about it. So if you feel worried about that, really, it's a painless thing. I think, you know, some of us may pick our nose even deeper than this, you know, but this is really a safe test. So I'm just excited that we have this opportunity for our kids throughout the network and within our school district, just for the safety of our kids. I mean, we love our kids and we worry about our kids and their families. And we know that some of them live at home with parents who perhaps are immunocompromised. And this is just going to allow that extra layer of safety for everyone. So thank you on behalf of myself and the CASMED, and I'm sure I speak for the other administrators here as well, for being a part of this and learning about what SAISD and the CAS network is doing for everyone. I appreciate that. Thanks for joining us today.
To kind of speak to that to the group, so our students, a lot of them have come up to me individually and said, this is so great. Please thank the CAS network and whoever's funding this with the grant. You know, let them know it was a grant that helped fund it. And because a lot of our students live with their grandparents. And so they're worried about somehow picking up something and taking it home. And then the same thing with faculty. You know, I know I have parents on the call, but it's nice to have faculty feel more self-assured, because nothing can beat having a teacher in person in the classroom. And a lot of them are caring for their parents, you know, with the age of what's going on. And they may have young ones at home, but then they've got aging parents. And so it's just taking a layer of stress or burden, because they don't want to come home with something and cause someone, a loved one, to become sick that they're helping care for. So it really is a community effort. It's about for the good of the community. And, you know, so far students and teachers at Cass Tech have been excited about it, but I'm sure it's that way for all the network schools. So thank you, parents, for being on today to consider this as you make some decisions.
I would really encourage you all, like I said, I put my personal email address in the chat. Parents that have any reservations about it, because we're a new company and this is a new thing for San Antonio, I would love to hear what your reservations are, just so we might talk through them. And so I'm better equipped next time I speak with parents to know what your concerns might be around this kind of testing.
We've had a couple more questions about consent forms, when they're due. Does any of the principals want to speak to that? I believe that you can bring the consent form right up to the test and be tested.
That's right.
Lead, you can send it to my email electronically or bring it Monday morning, but we'll probably be calling in the next 2 days to just confirm and answer any other questions you guys might have. But we're here to help, and I just want to brag on the CAS Lead students. They've been amazing with wearing their mask, sanitizing their space, staying 6 feet apart, doing all of those things and learning and doing everything that we've asked them to do. And also just amazing work that the teachers have done to really help students through this. So shout out to the cast, principals and students and wonderful parents. And we will be reaching out later on this week to see if you have any individual questions.
If anyone is more comfortable with Spanish, I can put my email in the chat as well, and feel free to contact me with questions, and yeah, happy to help out. So just my inbox is open to you guys.
Mauricio.
Yes.
I just want to say thanks for all the families who have joined us this evening to hear about this opportunity. And I agree with everything that my colleagues have said, and we appreciate you joining us and us all working together to add an extra level of safety to our schools.
And
I just want to echo that as well. We're just so proud of the CASTEM kids. They came in ready to be safe and support each other with when new kids come in, and that we're very proud of how they're teaching each other and holding each other accountable for being safe. So that we're thankful for. This additional layer of safety and security makes everybody in the building feel safer, and so that we can just get right to learning and right to joyful experiences at school. So thank y'all for making this possible.
Oh, no worries. No, I am just so grateful for this opportunity. We're really excited for our kids, for our teachers, and for our parents to have the opportunity to engage with the CAS network in this manner. So thank you. And Community Labs, what an excellent opportunity for all of us, especially our community in the downtown locations. Parents, our consent forms have not gone out yet. They will go out in person tomorrow, but we will work in the next couple of days to get this information out. We want to ensure that all students participate if you can, but whatever questions you have, please always email me directly, and I'll be happy to help facilitate those answers for you. Thank you again, and thank you for being here.
Again, in SAISD, we're excited about the partnership with Community Labs. We actually feel privileged to be able to be a part of this because, again, it's just another opportunity to ensure that our schools are safe places for students and for staff. So we look forward to working together and hope that this opportunity extends or can extend in the future if other funding is secured. So thank you.
We really want to thank you for taking the time on an evening and caring so much about your kids, all of our kids. I think we are stronger together, and this is, really an exciting chance for us to get back to school, which is something we all want to do in a way that we can all feel really confident about. So I hope that y'all are as excited as we are, but if you have some nervousness or anxiety, also don't feel ashamed of that. Please reach out to whoever you're comfortable talking to, whether it's your principal, whether it's Community Labs. I believe we also put info@CAS Schools email that you're welcome to reach out to. So don't feel like you don't have a place where you can go and talk to people if you have any additional questions or concerns. So thank you, and we'll stick around in case anybody wants to stay and chat with us or ask us some tough questions. Good night, everyone.